Hello everyone, it's Dr. John Makoff here. Today's topic I want to talk about is the concept of feeling safe and how that connects to healing, as well as what that might show up as in your body, like the different feelings that may indicate a lack of feeling safe. Because sometimes in our bodies we can't always interpret what we're feeling. As strange as it might sound, but it's true. And so if you don't know what you're feeling, how do you know what to address or how to go for help to help deal with it? Now, my colleague, Dr. Brad Campbell, did a little video on safety and its importance for feeling safe connecting to healing. And I thought was really good, and I thought I'd expand on that a little bit. Now, to heal, we need to almost get out of various levels of survival mode that we might be in for various reasons. Now, for survival, if we think about, running away from or fighting a grizzly bear, or maybe even freezing to hope that grizzly bear doesn't see us, these are different survival mechanisms, and the different mechanisms in our body that help us during those times is where it pushes sugar into the muscles to get them to fire quicker, get more oxygen into the system to get the muscles to fire quicker, be able to see better at night, to be able to hear lower vibration sounds. But also what that does is putting those aspects as a priority, it puts other systems as less of a priority at that period of time. Digestion, reproductive functions, basically anything dealing with resting, digesting, healing, those are all put on hold until you survive that period of time. Now, when our body doesn't know when that time is over, or if we still feel that we're on that constant threat for whatever reason, then we will have various issues with digestion, reproductive functions, anxieties, stress, sleep, various things like that. So on the first level of what we might be feeling are digestive issues, sleep issues, reproductive issues. But we can also go into various other things you might be feeling. So let's just put a little list here so that, because there's so much. So now some of these symptoms won't only be because of certain survival things, because sensitive stomach, upset stomach, hard time digesting could also be from various inflammatory issues, hidden infections, dysbiosis, which is different microbes, bacteria, fungus, parasites, interrupting our systems and causing various inflammation. Being a light sleeper, besides, and having difficulty falling asleep and waking up a lot, can also be blood sugar issues, but there is something to consider about the survival aspect. So we're just going to go through a little list of different things that to keep in mind, that if some of these things are showing up, there might be a feeling of lack of safety in various aspects of our life. And I, on a daily basis, help people with chronic issues to try to overcome these feelings of survival, see where they come from, bring awareness to it, help them process through it. That also aids in their healing process of whether it's a physical, mental, emotional, spiritual, lifestyle issues. So, back to the list. So, if you're someone who's a worrier, you have a lot of anxiety, depression, if you have constant muscle tension, tightness, headaches, jaw pain, stiffness, chronic health issues, chronic pain issues, fertility issues, sexual performance issues, pelvic floor issues, if you find yourself being very defensive or having to constantly justify an action, if you have many triggers, and especially when you're having the triggers and demanding others to conform to your triggers, that's definitely a lack of feeling safe, that you're trying to make others in your environment make you feel safe versus finding the root of why you're not feeling safe. Procrastination, a need to be right all the time. Perfectionism, inability to or difficulty being authentically you. Feeling well, we can go into all the different reasons. If you have any questions about any of these, please leave comments. Inability to speak up for your needs, wants, desires. Inability to make yourself a priority. Inability to say no. Difficulty being alone if you're a serial dater. Constantly comparing yourself to others to see how you are doing in some aspect of your life. Needing external validation. Needing to feel superior to others in some way. If you get easily embarrassed. Difficulty feeling comfortable, difficulty letting go of issues. If you have nightmares. If you're constantly fearful of situations, people, being alone, not being enough, men, women, authorities, environment, failure, success, something catastrophic happening to you or someone you care about, all of these are just little hints of where you may not be feeling safe and are constantly stuck in some level of survival that can be triggered at any time. You know, that lack of feeling inner peace, not that a lot of us have that, but it is an indicator of certain wounds that we might have from our past, from our childhood, that make us feel less safe. You know, if we grew up in a very authoritarian household or overprotective household, overly permissive, a passive-aggressive household, all of these where we don't know what to do and how to keep ourselves safe in some of these situations, whether it's lack of support or fearful of intimidation. You know, if we grew up with certain abuses, you know, especially if any of those abuses had the phrases put on us when we're young of, I'm doing this because I love you. So now you don't know if love is safe. You know, if you have a parent, one or either the parent or both, who modeled allowing people to violate their boundaries or not even having boundaries. So, and then impressing on you that that's what you should do, to either allow them to violate your boundaries or allow others just to feel safe in some way that people won't get mad at you for having boundaries. So there's a lot of these different situations. And for me, when I have patients with chronic issues, chronic health issues, we usually explore some of these aspects of why are they in a survival mode, or are they in a survival mode that's inhibiting their ability to heal. And then we can use certain techniques as neuroemotional technique I use a lot. Sometimes I do some patterning and seeing where the pattern comes from intuitively. Sometimes we can do some Akashic record sessions to see other aspects of what our subconscious is trying to tell us. And sometimes we see what other aspects are connecting and modeling for us. So hope that was helpful. And if you have any further questions, please leave comments or message me. If this sounds familiar and you think you need some help with some of these things, please message me or contact me through my website. And otherwise, I hope everyone's having a great rest of your day. Thanks.